Hi guys, how are you doing today? I hope you are all doing well. My name is Stella Simon and I'm a clinical nutritionist. I'd like to welcome you back to my YouTube channel. Thank you so much for the love. Thank you for the support. Thank you for subscribing to this nutrition channel. And if you're new here, please go ahead and subscribe. As you watch this video, please like the video. In today's video, I'll be sharing with you about replacement feeding or formula feeding, and I'll also talk about infant feeding in the context of HIV/AIDS. I would like all of us to understand and to appreciate that not all women can breastfeed, and this could be due to medical reasons. So how can we help them? What options do they have left? And for these women, you can always use the infant formulas, and there are so many in the market. For example, we have Nan, we have Cow and Get Nutristat, we have Liptomil, we have Lactogen, and we have Aptamil. Then if your baby is allergic to the cow milk protein, you also have options for you. For example, we have the Liptomil plus hypoallergic formula, and we also have the Cow and Get Nutripeptide hypoallergic formula. If you cannot afford the infant formulas, you can always use the cow milk. And I would like to say that for the conditions that affect the baby, we have galactosemia, whereby you find that the body is not able to digest galactose, which is the main sugar in breast milk. Then we also have another condition by the baby which we call phenylketonuria, whereby you find that there is a high concentration of the amino acid phenylalanine in the breast milk, and the body is not able to metabolize it, and at the end of the day there is a build-up of toxic products. Then other conditions that affect the mother, we have tuberculosis, that is one of them. We also have hepatitis, and we also have cancer, and specifically when the mother is going through chemotherapy. And I would also like to say that when you are purchasing your infant formula, it's always good to consult with your healthcare provider or with your nutritionist, so that you can be able to find out in case the baby has any allergies. And I'll also talk about infant feeding in the context of HIV/AIDS. I would like us to know that every woman, when they go for the antenatal clinic, HIV counseling and testing is done. And if you're found to be negative, counseling is still done. If you're found to be positive, counseling is done. And you have also enrolled at the Comprehensive Care Clinic, CCC, and you have started on antiretroviral therapy or antiretroviral drugs. When you deliver your baby, you have two options in case you are HIV positive. You can choose not to breastfeed the baby at all, and you can also choose to breastfeed your baby. And when you choose not to breastfeed your baby, we have what we call the Afass criteria. The healthcare provider takes through you this process to assess if you are fit for the replacement feeding or for the formula feeding. And it has 5 steps. We have the first one is acceptability, whereby there should be no barriers, and there should be no bias or stigma, and replacement feeding should be socially acceptable. Then we also have feasibility, whereby the mother should have the adequate resources. She's also supposed to have the right skills and knowledge so that they can settle on replacement feeding. Then we also have affordability, whereby the mother is supposed to be in a position to afford to buy the infant formulas for the period of 6 months, the first 6 months of life. And then she's also supposed to have the time to prepare the infant formula for the baby. Then we also have sustainability, whereby the mother is supposed to meet the demands that come in with replacement feeding. Because when the baby is born, they'll be taking a few mls of the infant formula, but as they grow, you need to purchase more infant formulas, so you have to be able to meet the demands. Then we also have safety, whereby the infant formula should be prepared in an hygienic environment, and it should also be correctly prepared. So if an HIV positive mother is able to meet these Afass criteria, then you give them the go ahead, and you also support them. And I would like to say that adherence to the ARVs drug is very key. Whether you choose to breastfeed your baby or not to breastfeed your baby, please try to ensure that you adhere to the regimen. And I would also like to say that whether you are breastfeeding your baby or you are not breastfeeding your baby, you are still the best mom to that kid, and it shouldn't make you feel discouraged or feel down. No, you are still the best mother to that child, and you are trying to give the baby your best. So that is it for today's video. Thank you so much for watching, and if you find this video resourceful, please give it a thumbs up, and also don't forget to comment, share, and to subscribe to this channel, Nutrition by Stella Simon, for more nutrition tips. I'll see you on the next video. Bye.